My name is Dr. Bernie Park. I am at Memorial Sloan Kettering Cancer Center, where I practice as a general thoracic surgeon, specializing in thoracic surgical oncology. Case we're going to discuss today is that of a 64-year-old woman. She had multiple ground glass lesions in the left lung, predominantly. We elected to use the most recent CT scan of the chest to create our SEVRA 3D model to better understand the distribution of her lesions, including the biopsied lesion, and the feasibility of being able to resect all of her disease while at the same time sparing as much parenchyma as possible. The 3D rendering was very helpful. We were able to see that we could encompass 3 of the lesions with a apical posterior segmentectomy of the left upper lobe, and a superior segmentectomy, and 2 of the lesions with a superior segmentectomy of the left lower lobe. So in this view, I've removed the lateral segment, and it shows you the power of this software and showing so you could see here that, again, 5/6 of this lesion that's in the more or less the center of the screen is in S6, but you could see that a little portion of it is crossing the fissure into the lateral segment. So that really shows you extremely well where your margin is going to be that's at risk, the border. It's something it's literally impossible to tell from conventional CT imaging. And it's a huge advantage to have this. Having this at the tip of my fingers, to be able to have the trainees have access to it, to be able to review it in the operating room easily. It's really indispensable to surgical planning, honestly. Without the SEVRA model, I think I probably would have erred on the side of removing a little bit more lung in the upper lobe. So I might have done either a tri-segmentectomy of the upper lobe, meaning the anterior and apical posterior segment, or a apical posterior segment and the lingula, leaving the anterior segment, and then either 2 wedge resections of the lower lobe, or a bisegmentectomy of the lower lobe, so a superior segment and a lateral basal segment. The pathologic margin on both the upper lobe segment and the lower lobe segment were well away, over a centimeter away from the closest tumor in each specimen. The patient recovered quite well. She had no complications, and she was discharged in good condition on the 3rd postoperative day. I've practiced enough now where I don't get too overly excited with operations I do, but in this case I really was kind of proud of the job that we were able to do for her. I think we really, in combination with the technology, really did her great service.